I would not want to be in a scenario whereby I'm taking so many medications per day. And you fall into a vicious cycle that you end up going to see several specialists. So you become a slave, a victim of the IST realm, the IST realm. I go to see the internist, I go to see the cardiologist, I go to see the rheumatologist, I go to see the endocrinologist. So I call it the IST realm. And nothing is wrong with that. Specialties exist for a reason. But many times these conditions have an underlying reason or cause. I saw a 68-year-old female patient at the office that I had seen about 20 months ago. I had seen this patient in 2 occasions, like with a month's difference between the first and the second visit. And she came with many issues. Among these issues, she had a history of a specific type of arthritis. She was having problems in her eyes, arising of the pressure in the eyes, which is known as glaucoma, high blood pressure. All of this caught my attention. And abnormal facial movements on one side of her face, like twitches. The characteristic I saw 20 months ago and the characteristic I saw today were pretty similar. Doc, I've come for help. Doc, rescue the situation. I really need help. Can you find that magic pill, that magic medication, injection, whatever it is, that's going to take off my problem like this in a whiff? And so I had to get down deep with her and ask, what are you looking for? I mean, how much money have you spent over the last decade and a half related to your health? And she said, Doc, I could have bought a piece of land, a standard property size, perhaps 100 by 100 feet, and built a house and furnished the house. It means it's a lot of money. So she has been hopscotching all around, including 20 months ago coming to see me on 2 occasions, and by her own accord decided I'm not going back. So it was obvious from the list of medications that she was drinking that it's only a band-aid fix. It is treatment designed to cover symptoms. And that's okay, because many doctors, that's what many doctors do. It's just giving something to cover a symptom. But it reaches a point that no longer works. And after 3-4 medications, medication number 5 perhaps is to take off the side effects of medication 4. Medication 6 takes off side effects of medication 5 and perhaps 3 because they're crashing or clashing. And it's a never-ending story, and before you know it, the person is taking 10, 12, 15, 20 medications. What do you want? Because if what you're looking for in me is to come back for another visit, 2 or 3, for me to prescribe something different than I prescribed the last time, to give you a band-aid treatment, then I can't help you. Sorry, I'm sorry, but I don't want to be a part of that, because I don't believe in band-aid treatments. And it's frustrating for the patient, for the family member, for the doctors, for everybody in society, that you're taking something that's just to cover the symptom. And I believe we have an obligation to dig further and see if we can offer more to our patients. That concerns me. So, you spent all this money. Are you willing now to invest in your health, to see what we can diagnose and what we can rescue and what we can treat? Because clearly, all that has been done in the past has clearly not worked. So that is food for thought for that patient. It is sad to see people having neurodegenerative problems that are linked to other problems in the body, chronic inflammatory conditions that are just getting band-aid treatments. It's like, For example, if I were to have a big cut, pretty long, pretty deep, you can't put 200 band-aids to close it. What would it need? It need to be cleaned. It would need to be, put a bit of local anesthesia perhaps, and then by layers, go closing that wound. You can't fix something that needs suturing, something more in depth with band-aids. We are a band-aid culture. It's frightening. Is it really a service to me just to be treating my symptoms? Would it be better for me to look and try to get to the bottom of things? I think it's worth the while. I really think it is. So I don't know if this patient is going to listen to me, because a lot of people put in a balance and they don't want to make an investment in their health. It's a quick fix. It's running to the pharmacy, it's running to the doctor, it's prescribed something for me, I have this symptom now. Perhaps you're lucky and you're going to guess, you're going to find out, by pure luck that this is the medication I need. But a systematic, in-depth study of a patient, it's not something that most family members of patients are willing to back up and go through. And it's something that most patients do not have the patience to undergo. So it's okay, I'm sick, fine, whatever it is, just give me a pill. This is the prescription, just give me a pill, and I'm good with it. I'm going to go home, I'm going to have this, and I'm not going to change my habits, I'm not going to change my lifestyle, I'm not going to change my mindset. I'm going to continue the exact same way I have been doing things all my life. Does that work? The question is, does that really, really work? Personally, I don't think so. Experience has taught me it does not work like that. And it's hard because you talk to people and people look at you and, yes, doctor, I believe what you're saying. And the moment they walk out, it's like they're gone for a while, and they see you in public and, hey doc, yes, I haven't come to do the test as yet, or I haven't gone to do the test as yet. I'll do whatever study, I'll do the heart test, and I'll do the EEG, and I haven't had a chance to see the cardiologist. So why come to see me or to see a doctor like me if what you're looking for is just a band-aid treatment? I can't work miracles. I'm pretty sure about what I do as a health professional because I'm well trained, I have tons of experience, and I'm a thinker, and I'm a seeker, and I'm always looking for more information and trying to learn from every angle that I can. For what? So that you can put this inside your treatment protocols as time goes by. Nothing is shameful in that. So you should have an open mentality that learn from everybody. You learn the do's, you learn the don'ts. I'm hoping my patient today learned the do's and even the don'ts. The don'ts is you don't sit down on your health for 20 months. Because in the talk we had, nothing has been done in 20 months. If you don't invest in your health, you will be walking on this earth less years than you should. Or you're going to be on this earth, but your brain is going to age and get ahead of you. So you're going to be here in body, in person, but you're not going to be here in mind, in your intellect, in your thought processes. You'll be gone. There are many names for those conditions. One is called dementia. There are others. Parkinson's disease, depression, anxiety. So I stop and think and I say, we all have a time in our lives that we procrastinate. We say we're going to do something and we just don't get it done. I'll do it tomorrow. I've seen it in my big daughter. She's like, no, I'm going to do it tomorrow, Dad. I'm like, nope, you're going to do it today. And even myself, there are times I procrastinated, and you look back and you say, it's like, no, I could have done that earlier, sooner, different results, So the patient is human. But 20 months? Wow. 20 months. And then the realization that one of two things. When I saw that patient in the first two occasions, oh, doc, first time, doc, I improved a lot, I'm feeling good at what you prescribed. I improved improved, doctor, I did improve. And then comes back on the second occasion and says, well, correction, the patient came one time, gave a treatment, patient came back the second time, said she had improved. Then the patient never came back. So treatment 2, second visit treatment, was an upgrade from the first treatment. Did it work? Did it not work? Was the patient too kind and not wanting for me to feel insulted in saying that perhaps my first treatment had not worked? Perhaps. Could it have been that this patient expected much bigger results? I don't know. What I was able to decipher that in the time this patient had not seen me, this patient had crossed borders to go for consults elsewhere because of the medications that I saw were being taken when I did that brief history taking today. And half those medications were not being taken the last time. So that means that my treatment plan was abandoned, even though I was told today, oh, doc, excellent, I felt very good with the treatment you gave me. So why didn't you come back? Why didn't you continue what I gave? Why didn't you at least call the office and ask, I don't want to see the doctor, I'm not too interested in my health, so could he just extend the same prescription again? It didn't happen. So the patient doesn't have to lie to me. That patient wasn't convinced and went elsewhere and was what? Doctor shopping. There's a concept. I met my wife. I adore my wife. We get along very fine. We're like best friends. We talk. We seldom have squabbles. That's like perhaps once a month. Small squabble. Nothing much, nothing fancy. But we have chemistry. There's a bond, a very strong bond that holds us there. Yeah, there's a lot of respect, a lot of love, admiration, very strong friendship that holds us together. Makes us a strong couple. In the same token, when you as a patient go to see a doctor, you have to feel chemistry with your doctor or chemistry with your therapist, your counselor, whoever the person is. You have to feel a level of chemistry. Don't get me wrong. This is not a chemistry that you like your physician in a personal way, your therapist in a sexual way. No. I'm talking about the chemistry that you have to feel so you can identify with that person. And when he or she gives you whatever advice, recommendations, instructions, you will do it willingly because you are convinced that that's the correct person for you. So when you go to see a doctor, a therapist, a counselor, whoever that person is, and this is not only in the medical field, if you do not feel that connection, that chemistry with that person, hello people, go and look for somebody else. You're wasting your time, you're fooling yourself if you're going to stick with somebody you don't have that chemistry with. Because if you don't have chemistry, you will not respect what that professional has to say, what instructions that professional is giving, that you're just simply not going to do. You're going to do it 1 day, 2 days, 3 days, and then it's going to be chucked aside, prescription in a corner, medications in a corner, instructions for therapy exercises, note-taking, writing a diary. It's going to be thrown aside. Why? Because you did not responsibly tell yourself, I do not connect with that gentleman, I do not connect with that lady.